Cerebral palsy. Cerebral palsy is a gathering of problems that influence development and muscle tone or stance. It's brought about by harm that happens to the youthful mind as it grows, regularly before birth. Signs and manifestations show up during early stages or preschool years. All in all, cerebral palsy causes disabled development related with strange reflexes, floppiness or inflexibility of the appendages and trunk, unusual stance, compulsory developments, flimsy strolling, or a mix of these. Individuals with cerebral palsy can have issues gulping and usually have eye muscle unevenness, in which the eyes don't zero in on a similar article. They additionally may have decreased scope of movement at different joints of their bodies because of muscle solidness. Cerebral palsy's impact on work differs enormously. Some influenced individuals can walk, others need help. A few groups show ordinary or close typical insight, yet others have scholarly handicaps. Epilepsy, visual deficiency or deafness likewise may be available. Side effects. Signs and side effects can differ incredibly. Development and coordination issues related with cerebral palsy include varieties in muscle tone, for example, being either excessively solid or excessively floppy. Firm muscles and misrepresented reflexes, spasticity. Firm muscles with typical reflexes, unbending nature. Absence of equilibrium and muscle coordination, ataxia. Quakes or compulsory developments. Moderate, squirming developments. Postponements in arriving at engine abilities achievements, for example, pushing up on arms, sitting up or creeping. Preferring one side of the body, like coming to with one hand or hauling a leg while slithering. Trouble strolling, like strolling on toes, a squatted walk, a scissors-like stride with knees crossing, a wide step or an uneven stride. Over-the-top slobbering or issues with gulping. Trouble with sucking or eating. Deferrals in discourse improvement or trouble talking. Learning challenges. Trouble with fine engine abilities, for example, closing garments or getting utensils. Seizures. Cerebral palsy can influence the entire body, or it very well may be restricted principally to one appendage or one side of the body. The mind problem causing cerebral palsy doesn't change with time, so the indications normally don't deteriorate with age. Notwithstanding, as the kid gets more seasoned, a few side effects may turn out to be pretty much clear. What's more, muscle shortening and muscle inflexibility can decline if not treated forcefully. Cerebrum irregularities related with cerebral palsy may likewise add to other neurological issues, including trouble seeing and hearing, scholarly handicaps, seizures, unusual touch or agony discernments, oral infections, psychological well-being conditions, urinary incontinence. When to see a specialist. It's essential to get a brief determination for a development problem or deferrals in your kid's turn of events. See your youngster's primary care physician on the off chance that you have worries about signs of loss of consciousness of environmental factors or of unusual real developments, strange muscle tone, impeded coordination, gulping troubles, eye muscle irregularity or other formative issues. Causes. Cerebral palsy is brought about by an anomaly or disturbance in mental health, regularly before a kid is conceived. Much of the time, the reason isn't known. Variables that can prompt issues with mental health include quality changes that lead to strange turn of events, maternal diseases that influence the creating embryo, fetal stroke, an interruption of blood supply to the creating mind, seeping into the cerebrum in the belly or as an infant, baby contaminations that reason irritation in or around the cerebrum, horrendous head injury to a newborn child from an engine vehicle mishap or fall, absence of oxygen to the cerebrum identified with troublesome work or conveyance, in spite of the fact that birth-related asphyxia is significantly less generally a reason than truly suspected. Hazard factors. Various components are related with an expanded danger of cerebral palsy. Maternal well-being. Certain contaminations or poisonous openings during pregnancy can fundamentally increment cerebral palsy hazard to the child. Contaminations of specific concern include cytomegalovirus. This regular infection causes influenza-like indications and can prompt birth surrenders if a mother has her first dynamic disease during pregnancy. German measles, rubella. This viral contamination can be forestalled with an immunization. Herpes. This can be passed from mother to kid during pregnancy, influencing the belly and placenta. Irritation set off by contamination can harm the unborn child's creating sensory system. Syphilis. This is a physically sent bacterial disease. Toxoplasmosis. This disease is brought about by a parasite found in sullied food, soil and the excrement of tainted felines. Zika infection contamination. Babies for whom maternal Zika disease causes their head size to be more modest than ordinary, microcephaly, can foster cerebral palsy. Different conditions. Different conditions that can expand the danger of cerebral palsy incorporate thyroid issues, scholarly incapacities or seizures, and openness to poisons, like methylmercury. Newborn child sickness. Ailments in an infant that can enormously expand the danger of cerebral palsy include bacterial meningitis. This bacterial contamination causes aggravation in the layers encompassing the cerebrum and spinal line. Viral encephalitis. This viral contamination also causes aggravation in the films encompassing the mind and spinal rope. Extreme or untreated jaundice. Jaundice shows up as a yellowing of the skin. The condition happens when certain results of utilized platelets aren't sifted from the circulation system, seeping into the mind. This condition is ordinarily brought about by the child having a stroke in the belly. Different components of pregnancy and birth. While the expected commitment from each is restricted, extra pregnancy or birth factors related with expanded cerebral palsy hazard include breech show. Infants with cerebral palsy are bound to be in this feet-first situation toward the start of work instead of being heedlessly. Low birth weight. Children who weigh under 5.5 pounds, 2.5 kilograms, are at higher danger of creating cerebral palsy. This danger increments as birth weight drops. Various infants. Cerebral palsy hazard increments with the quantity of children sharing the uterus. In the event that at least one of the children kick the bucket, the survivor's danger of cerebral palsy increments. Untimely birth. Children conceived less than 28 weeks into the pregnancy are at higher danger of cerebral palsy. The previous a child is conceived, the more noteworthy the cerebral palsy hazard. Complexities. Muscle shortcoming, muscle spasticity and coordination issues can add to various complexities either during adolescence or in adulthood, including contracture. Contracture is muscle tissue shortening because of serious muscle fixing, spasticity. Contracture can repress bone development, cause issues that remains to be worked out, and bring about joint distortions, disengagement or incomplete separation. Untimely maturing. Some kind of untimely maturing will influence a great many people with cerebral palsy in their 40s due to the strain the condition puts on their bodies. Unhealthiness. Gulping or taking care of issues can make it hard for somebody who has cerebral palsy, especially a baby, to get sufficient sustenance. This can hinder development and debilitate bones. A few youngsters need a taking care of cylinder to get sufficient nourishment. Psychological wellness conditions. Individuals with cerebral palsy may have psychological well-being conditions, like misery. Social detachment and the difficulties of adapting to inabilities can add to sorrow. Heart and lung illness. Individuals with cerebral palsy may foster coronary illness and lung sickness and breathing problems. Osteoarthritis. Tension on joints or strange arrangement of joints from muscle spasticity may prompt the beginning stage of this difficult degenerative bone sickness. Osteopenia. Breaks because of low bone thickness, osteopenia, can come from a few basic factors like absence of versatility, healthful inadequacies and hostile to epileptic medication use. Anticipation. Most instances of cerebral palsy can't be forestalled, yet you can reduce chances. In case you're pregnant or intending to get pregnant, you can find these ways to keep solid and limit pregnancy complexities. Ensure you're immunized. Getting immunized against illnesses like rubella, ideally prior to getting pregnant, might forestall a contamination that could cause fetal mind harm. Deal with yourself. The better you are going into a pregnancy, the more uncertain you'll be to foster a contamination that outcomes in cerebral palsy. Look for right on time and ceaseless pre-birth care. Ordinary visits to your PCP during your pregnancy are a decent method to lessen well-being dangers to you and your unborn child. Seeing your primary care physician routinely can help forestall untimely birth, low birth weight and contaminations. Practice great kid security. Forestall head wounds by giving your kid a vehicle seat, bike cap, well-being rails on beds and fitting management. Keep away from liquor, tobacco and unlawful medications. These have been connected to cerebral palsy hazard.